Watching Checkpoint, thank you for staying with us. The 100th day since the first coronavirus case was reported in the country. The CS, while addressing members of the press on his daily brief today, talked about the hits and misses on how Kenya has performed so far in dealing or curbing coronavirus. But tonight we focus on then what next? The next 100 days, what awaits us? Experts said that perhaps the peak would be August, September. Today we reported the highest number of infections. So what are we likely to see in the coming days, and are we prepared for that? Professor Omwanzala now joins us live, of course, from home there, and to just speak to us about that. He's a virologist at the University of Nairobi, and as I mentioned, a very key figure in Kenya's plans, advising the government on how we can go about this. Professor, thank you very much for joining us here tonight on Checkpoint. Day 100. Still also marking the highest number, 260 infections so far. Perhaps quickly just take us through what the 100 days have been like. Are we on the right track as a country?
Thank you so much for inviting me to shed some light on what is going on now. I think from the very first time that the first case was diagnosed in March, a lot have been put in place in terms of ensuring that containment is managed, mitigation is managed, and all these things, including issues of hand washing, wearing masks, social distancing, ensuring we test, we can put those who have confirmed in isolation. To a large extent, this containment and mitigation has worked, including the travel restrictions in Mombasa, Nairobi, Kwale, including a bit of lockdown in Eastleigh, as well as Old Town in Mombasa.
So what hasn't? Where are the loopholes?
Really, the loopholes is that when one is using public health interventions, just like the ones we have described, there's never 100% adherence. And hence, you wouldn't call them loopholes as such. I would refer to them as just the issues surrounding these kind of measures that require individual decision and also, individual perception of risk. And that's why you see the way things have gone. You know very well that from the initial modeling that we had done at the University of Nairobi, and the idea saying that if we didn't do anything or if we did nothing, we'd have seen very, very high numbers. But what so far has been put in place has ensured that to a large extent, that curve has been flattened. The healthcare system, to the extent as we are now, has not been overwhelmed. And maybe this is the way we need to go, but ensuring that we can communicate the risk management very well. We can communicate to the individuals and citizens to at least try to adhere to these measures closer to 100% as possible.
So then talk to us about a curve, because experts talked about, and even the government talked about a peak of August, perhaps September. We are seeing the numbers continuing to rise by the day. Where are we now compared to, of course, when we get to the peak and the decline? Speak to us about the period between now and what we're likely to face ahead in terms of our curve.
Yeah, exactly. What we are going to face is that the restrictions that have been put in place have kept the infection mainly in the big cities where the initial introduction from abroad was brought in, mainly Mombasa and Nairobi and the environs. And then also there's been importation brought about by the truck drivers. But as we go ahead, there is actually the need to balance travel restrictions and all these things with opening up the economy, ensuring that people can go back to become productive, those who can be able to go back to work, those who can still be able to work at home. So we talk about the peak, but I also want the citizens to understand that the peak is just maybe the highest level we can go, but also that will mean that those are the people we have actually been able to reach and diagnose. There'll be the silent outbreak where we don't see those individuals, they don't come to hospital, and they don't present with the disease. That is the nature of the natural history of this infection. Mm-hmm. But even after that, there will be we shall begin to see a slow decline. The peak should not be assumed to be that you are in a plane, you peak, and then after the peak you come down with a parachute. No, it will be a slow simmering of this infection for several months before we actually be able to notice that there is indeed a complete decline, and we are seeing less and less people coming in with confirmed COVID, and at the same time we should be able to see a decline in the number of people who are passing away because of COVID.
The CS today talked about...
So the emphasis...
Yes, just finish your points. My apologies, finish your point.
So what we really want to communicate is that the peak should not be construed to mean the end of the outbreak. Yeah, there'll still be several months and several weeks that we must be able to continue with containment and mitigation to ensure that our healthcare system is not overwhelmed.
So then what should we think about doing differently as we head into the next 100 days, perhaps 3 months? We're now talking about mass testing, looking at samples so far of 140,000 samples. We are talking about home-based care now. The CS today preparing us of a stretched medical or health system in the country. What should we do differently going forward? What should we prepare for?
I think what we should all be prepared to do is, one, we should all ensure that all these measures that have been put in place, we try to adhere to them almost 100%. Social distancing, ensuring we put on masks, ensuring we sanitize, ensure that we shield those who have comorbidities so that they don't get infected. But more so, we want to be able to ensure that the MOH works with the county governments to really ensure that the counties are actually also ready to be able to confirm COVID infection in their counties, to be able to isolate those individuals who need to be isolated in healthcare facilities, be capable to contact trace. They should be able to actually find out any pockets of infection within their counties and ensure that those areas of heightened infection are ring-fenced to avoid spread to other areas. So really, in the next 100 days, the country must be opened up to some extent to allow majority of people to try and go back to near normal, because everybody says this is a new normal. That is true, but we should try and go back to near normal as possible so that universities can open, schools can open, traveling can open. But this should be opened in the context of a healthcare system that is prepared, that is ready. But at the same time, ensuring that the citizens are aware of the risks involved, and all the measures that have been spelled out are actually adhered to as close to 100% as possible.
But then where we are now, we are seeing a bit of laxity that even the government has decried on how people are treating this virus. Some of the stringent measures that were put in place, we're not seeing strict adherence to them, social gathering being one of them. And it's not just the ordinary Kenyan, we are seeing it right from the top with politicians. Does this worry you? Are we likely to suffer more because of the laxity and the attitudes we have currently towards this virus?
In any situation, leadership matters. And leadership matters a lot. So really the top leadership must show guidance. So when we say we should avoid gatherings, then indeed it should actually come from the very top. Because lack of adherence to all this social distancing, lack of adherence to wearing of masks in public spaces, lack of adherence to sanitization and what have you, will actually bring about enhanced transmission of this infection, and eventually the healthcare system will be overwhelmed. So really what we want at any level, from top to the bottom, we want to be able to see at each level leadership in terms of that these measures have been put in place, all of us are adherent to these measures. Because COVID has not gone away, and COVID is not going away very soon. But the idea here is to ensure that we shield those who are vulnerable, we shield our healthcare workers who are on the front line. We ensure that our hospitals are not overwhelmed so that other infections that we normally take into account on a normal basis can actually be taken care of. So this is what, really this is the message that I would pass, that in the next 100 days, these are the things that as an expert, as somebody who understands virology and health very well, these are real measures that we would like to see all of us adhere to.
Prof, talk to us about the space for vaccines. We can see a lot of trials and research currently around this. Is there any hope in the medical and science world in coming up with a proper vaccine?
You see, the natural history of this infection, and by natural history, this vaccine has, this virus has been with us, this virus has been with us for only 6-7 months now. But when we compare this virus with other viruses that belong to the same family, it is clear that it will emerge that indeed it will induce an immune response, but an immune response that may not last for very long. But indeed, that immune system can be used to develop a vaccine. There are over 100 vaccine candidate products for SARS-CoV, which is the virus, SARS-CoV-2, that is a virus that causes COVID, in various stages of development. Even us at the University of Nairobi, we are beginning to think about collaborating with our colleagues out there so that when the time comes to test this vaccine in humans, that we should also be ready to be part of that global effort to bring a vaccine to the general public. So indeed, the vaccine will be the biggest game changer. And I believe all of us must put effort there. I know there's a lot of trials also looking at drugs. There are also trials looking at cure. But from the infectious disease of point, from the virology and looking at infectious diseases, the best game changer is always a vaccine, because a vaccine will give you proper protection for a prolonged period of time. So that's the real aspect that we will all like to get involved in.
Prof, as we wind up, I know you've touched on this tonight, but to reopen and to stay open. We see countries that have tried reopening. Look at China, Beijing, look at South Africa. Almost like we keep seeing a relapse and a growth in numbers once that happens. It's pretty scary, even as we have a conversation around reopening. Because Kenyans say we are tired, but when we look at countries that have gone before us, I mean, what are the dynamics? What should we really be keen on right now, even as we have the conversation of reopening?
You are totally point on, totally point on. And that is the whole point of proper adherence to these non-pharmaceutical interventions and ensuring that all these things are communicated, the risks involved, because you don't want to open and close again, because what our advocacy will be in the next 100 days that we want each and every sector to look at itself, each and every sector to assess its risk, and each and every sector to bring in conditions that they will adhere to completely, so that when they reopen, they are not forced to close again because there were some gaps in terms of how they assessed their risk. So these are the things we need to be discussing. From what do we need to put in place to reopen schools? What do we need to reopen in terms of universities? What do we need to put in place to reopen universities? What do we need to put in place to reopen churches? Each of these sectors will have to assess the risks involved and come up with very clear guidelines that this is indeed what we want to do, so that we open and remain open. We don't want to open and close because the number of cases have started going up. And you see, that's why we are actually communicating. We are not out of the woods. Mm-hmm. China opened up. Now we see the problems in Beijing. Certain markets are closed, certain sectors of Beijing are closed, and that's what we really want to avoid. And that's why we requested that we are given another 30 days. Mm-hmm. And this in 30 days, I will seek all the citizens, each of us, to the level of your own home state. Look at your risk assessment and see what you need to ensure to put in place that there is less and less transmission of COVID at each of those sectors. And then also just to talk a little bit about home isolation.
Yes.
And community isolation. Mm-hmm. We are trying to stay away from the word home-based care. Mm-hmm. Because the traditional use of home-based care is to take individuals at home who have a terminal illness. And then somebody will be responsible at home to take care of them. What our position is that for home isolation, we shall actually be looking at individuals who are diagnosed with COVID, right, but at that point don't have any signs and symptoms, mm-hmm, but are able, because of the nature of how they live, they are able to go home, mm-hmm, isolate themselves, and be able not to transmit these infections to their members, to their extended members of the family. Right. So there's a triage system, and those who can't then can go into what we shall call community isolation. Okay. Yes.
All right. Thank you very much. I wish we had more time.
That's what I hope. That's what I hope, that in the next 100 days, those are the kind of things we want to see, that we open and remain
open.
Remain open.
Thank you very much, Professor Omu Anzala, virologist at the University of Nairobi. That yes, we do want the country to open up, but what do we do to open and remain open? Not open, close, and quite a fruitful conversation there with Professor Omu Anzala, as I said, from the University of Nairobi. Of course, taking very simple steps right into your home to ensure that you make risk assessments on how you can keep this virus at bay. I want us to quickly take a short commercial break here on Checkpoint. When we get back, a number of Kenyans stranded in Dubai. What's happening? We'll be giving you more.